Good morning, everyone. My name is Sandy Brown. I am currently the chair of the Area Agency on Aging Advisory Council. I am a city council member in the city of Santa Cruz, and I am thrilled to be here this morning to hear about this launch for the Master Plan on Aging. And this is a statewide effort. It's huge, as you all, I'm sure, are aware. And we're lucky to have Amanda Lawrence here to give us an overview and introduce it. And then we'll talk later about what we want to be doing at the local level and ask others to participate as well. So just a few words. Amanda Lawrence is the project director of the Master Plan for Aging at the California Department of Aging. And immediately prior to this, she served as a strategist and program consultant on several projects at the California Department of Public Health, including the launch of the department's Healthy Aging Initiative. So following graduation from the University of Wisconsin-Madison, a passion for health and social justice led her to earn a Master of Public Health and to work for international community-based and healthcare nonprofits promoting health and equity, including the planning and implementation of community organizing efforts with and for older adults in Nicaragua. So we're very fortunate to have Amanda here today with us and working on this project for the state of California. Welcome, Amanda.
Hello, everyone. I'm going to go ahead and screen share. Let me get this set up for a moment. Oh, no. There we go. Okay, good morning. Well, thank you so much for inviting me. I'm really excited to be doing local events with folks down on the ground because, yes, this master plan for aging, it's, written sort of at this state level, but it's so important to us that we really engage with local communities and ensure that we have a strong network and just a sense of community and a support for implementing local projects on the ground. Thank you, Clay, and everyone else. I'm going to go ahead and review a bit of the background behind the Master Plan for Aging, how we created it, where we landed on it, and what our next steps are. So, as we're all aware, the Master Plan for Aging launched on the infamous January 6th, terrible day to launch a project that you want to get some press attention on. But we go to our website, we have it fully available on the website. We also have 2 print reports, one a little more printer friendly than the other. One is this beautiful slick one you see on the screen. We also, of course, have that local playbook that you're talking about today and that data dashboard for aging. And we released that data dashboard for aging on January 6th, but we've had several enhancements since then, and we continue to enhance that dashboard. So I'll talk a little bit about that dashboard in a few moments. And of course, this all started when the governor called for the creation of the MPA back in June 2019. For years, folks have been asking for this master plan. This is no secret that we have a large older and aging population in California and elsewhere, many places around the world. So it was only a matter of time before this happened. Quite grateful that Governor Newsom decided to finally call for this master plan. And within it, he asked for a 10-year plan. He asked for us to convene a stakeholder advisory committee, which had 35 people on it. We also had a long-term services and supports subcommittee, a research subcommittee, and then we created an equity work group to ensure that an equity lens was applied to this planning process. And so we know that Californians are living longer than ever before. Californians actually have the 2nd longest life expectancy in the country. This is slightly old data. At almost 82 years on average is our life expectancy in California. Unfortunately, the reality of COVID will impact this number. It's not going to be as high probably in the next round of data collection, but nevertheless, still living longer than ever before. But there are serious disparities and discrepancies in how long people live. And so when I go through the master plan, I hope you see that we really put a focus here on equity and trying to eliminate these inequities that result in disparities in life expectancy. The life expectancy in California is lowest for Black Californians at about 75.1 years, and it's the highest for Asian Californians at about 86 years. So that's about an 11-year gap in life expectancy in California. I also want to point out, and this is a quote from one of our SAC, Stakeholder Advisory Committee members, Fernando Torres Gil, one of the godfathers of aging, really a national treasure. This is really about the life course of aging. This plan is not just for older adults. This plan is for everyone who is an older adult, will become an older adult, knows an older adult, cares for, loves for an older adult. So really, absolutely everybody. We want to make sure that we partner across all of our sectors and partners within the government to ensure that this healthy aging lens is actually applied from birth and throughout our life course. And here we have California older adult population, or really our population by age distributions and groups. Big takeaway here, and I'm sorry, this slide is very blurry. On the left here, we have in 2010, that dark blue bar on the furthest left is folks who are 0 to 18 years old. They outnumber that orange bar who are the 16 above back in 2010. So by 2030, you can see that we're going to have more folks over 60 than under 18. And then by 2060, we're going to have 1/3 of California's population will be over 60. And so I feel like we really need to do a really good job communicating to people that these demographic shifts, they are touching on our lives personally, whether you realize it or really are cognizant of that or not. I mean, you might be caring for a loved one, or you may be receiving care. You have to, there's retirement planning. We have a lot of older adults, a lot of folks who just aren't ready to retire. They don't have the savings available. We really need to work on that. Your healthcare, your living arrangements. In California, we have a lot of multi-generational households with 3, maybe even 4 generations living together. And that can be cultural, or that could be a financial need, or that could be because there's a need for caregiving in that home. So there's all these things you need to think about personally when it comes to aging. But then as a broader societal level, we have to really focus our policies to improve our healthcare, our long-term care financing, our community planning, our pension system. We really built a society based on this outdated idea of what aging means. And also we built it around, a different demographic breakdown. And then we also know that we have a really diverse older adult population. It will only become increasingly diverse. So you can see here in 2010, about over 60%, around 60% of the population of 60 plus was white non-Hispanic. And by 2060, white non-Hispanics will only comprise about 24% of older Californians. So this has a lot of implications related to equity, cultural competency, language access, just all sorts of things we need to think about when we think about making planning and community planning and service planning for older adults. And then, as I said, ensuring equity in aging is a key component of the master plan for aging. We really want to think about how program systems and policies, how we can use those as tools to eliminate those disparities we see experienced by communities of color, LGBTQ, older adults. So I'll go over a little bit of how we got here. Clay was involved in this process. We had a Together We Engage. I should have capitalized the AGE and engage, my bad. So we had, it was over a year of really comprehensive stakeholder input. And so we had public participation. All of our meetings were available to the public. We encouraged public comment at our stakeholder committee meetings. We also had webinar Wednesdays. We had about 10 of those where we had a local leader and a state leader, maybe even a nonprofit leader, talk about the services they're providing or talk about policy recommendations to create age-friendly environments. And so those were available to the public, and we encouraged comment during that as well. And then with our stakeholders, of course, we had all those stakeholder advisory committees that I mentioned earlier. It was in 2020, I think it's February 2020, when the team recognized that we really needed to focus on equity and have a select group of people come together. So we formed that equity work group, who then throughout this process provided input and recommendations to our stakeholder advisory committees to ensure that the recommendations that they created for the administration for the master plan truly did not only not harm or further exacerbate inequities within our communities, but actually tried to bridge the divide and ensure that we were really taking into consideration everybody's unique needs. We had several legislators host community roundtables across California. Director McCoy Wade and CHHS Secretary Mark Galley visited a couple locations as well to learn about workforce development and other topics. We also aligned, of course, with the governor's task force on Alzheimer's disease prevention and preparedness. obvious alignment there. So around March 2020, we aligned our forces, and you can see throughout the master plan that those recommendations that group came out with are also in alignment with what the stakeholder advisory committee put forth. COVID-19, we couldn't, of course, make a master plan without taking into account the awful impact that COVID-19 has had on Californians, particularly Californians of color and older adults. Really shined a light on ageism, as well as racism. So we had a public survey, we had several meetings with the secretary to really just enforce and really make sure that we addressed those things, those cracks that were identified, or at least more highly identified during COVID than in previous times. And then by the end, so this was in October 2020, the Stakeholder Advisory Committee released their recommendations. Those recommendations then went to the Cabinet Work Group. We'll talk a little bit. Oh, I also want to talk about how important local engagement is. So during the Master Plan for Aging stakeholder process, we had Board of Supervisors Catherine Barger on the Stakeholder Advisory Committee from Los Angeles, and we also had Jan Arbuckle from this from Nevada City. During Webinar Wednesdays, we had a lot of locals present. And then we also just had San Diego and LA present their their local plans at our advisory committee. Santa Cruz actually presented on isolation, including the We're Still Here exhibit, that amazing art exhibit. So we highlighted that, I believe, in one of our Webinar Wednesdays. Now I'm going to hop back to Stakeholder Advisory Committee. So the advisory committee came up with 800 recommendations to the administration for the Master Plan for Aging. That's a lot to digest. And it goes to show how complex these issues are and how much thought and work went into creating these. So these were some workhorses of work committees really putting forth a phenomenal final report. When we were going through the Master Plan for Aging process, we actually had these 4 goal areas as the original goal areas, which was LTSS, livable communities, health and well-being, economic security, and disaster preparedness and response. And you'll see, you know, in the final 5 goals that we came up with, basically we added 1 for workforce development. So those 800 recommendations from the Stakeholder Advisory Committee also included the specific equity recommendations. They also included climate change. We had an ad hoc climate change committee develop recommendations for how we can do age-friendly climate planning. We also had technology recommendations and a research agenda recommendations. So here are the 5 final goals I think you're probably familiar with: housing for all ages and stages, health reimagined, inclusion and equity, not isolation, caregiving that works, and affording aging. So I'll just go through real quickly some of these goal areas, well, all the goal areas. So goal 1, housing for all ages and stages. That is, the goal is we will live where we choose as we age in communities that are age, disability, and dementia friendly, and climate and disaster ready. So when I think of this goal area, I think of that livable communities goal. I think about social determinants of health, because while our target is millions of new housing options, and one of our strategies there is more housing options, really the physical place where we live is just one component of this goal area. We also want to focus on building really affordable and accessible transportation that gets people from point A to point B in a fairly seamless manner. You know, a lot of times people have to go just what is a 15-minute drive, but it's 2 hours on public transportation. So we want to remedy that. But we also know that some people aren't going to give up their cars. So we do have some driver safety initiatives in there. Outdoor and community spaces for all ages. So really we want to make sure that we have age-friendly parks and recreation. And while the majority of volunteers at our parks are actually older adults, only about 4% of older adults actually make use of our parks. So we want to identify what's going on there. How can we make these parks more friendly? And can we encourage intergenerational engagement when we build out age-friendly parks? Like, can we put them next to, you know, a preschool or a daycare center or something? And then we also talk about emergency preparedness and response in this goal area. Older adults and people with disabilities are dramatically disproportionately harmed by disasters and emergencies. So we want to ensure that we have the tools, resources, and education to protect older adults and people with disabilities and ensure that they have all the resources to evacuate or stay safe, stay informed during emergencies. And then climate-friendly aging. Really, green planning is the same as age-friendly planning. So we really want to make friends with our local planners and developers and drill that into everyone's minds that if you're going to build a green, eco-friendly building or environment, it's probably should be and could be age-friendly and disability-friendly as well. In goal 2, health reimagined, we will have access to the services we need to live at home and in our communities and to optimize our health and quality of life. And so here we really want to close that life expectancy gap that I talked about earlier and close the equity gap in a number of indicators. And so some of our strategies here include bridging healthcare with home. And so that's going to be that long-term services and supports recommendations. Those initiatives are in here. Healthcare as we age and lifelong healthy aging. A lot of this has to do with education and resources for clinicians and the public. Geriatric care expansion. You know, we just have very few people who are certified and trained in geriatrics. And so we'd like to see not just more geriatricians, but more cross-disciplinary people, teams who are trained in geriatrics. So a social worker and the clinician and others on that team, a counselor, if they were trained in geriatric care, that would just, you know, make such a big difference for a lot of older folks. And also increasing the number of geriatric emergency departments that are certified in California. We have quite a few, and West Health down in San Diego is one of the leaders in that movement. Dementia in focus. So, well, there is a bit of dementia related initiatives threaded throughout the master plan. The bulk of them are right here in the strategy, really trying to ensure that our research and our treatment and our diagnoses are targeted towards those who are disproportionately burdened by Alzheimer's disease, which is typically, you know, women of color are the most burdened by dementia and Alzheimer's disease. And then nursing home innovation, of course, is in here. And that also kind of fits into the housing for all ages and stages of goal 1. So there's a lot of overlapping between some of these goal areas. And then we have goal 3, which is equity and inclusion, not isolation. And so even though we did, you know, make a conscious effort to thread equity throughout all of the master plan, we did still feel that it needed to have its own goal area. And so in here, our goal is that we'll have lifelong opportunities for work, volunteering, engagement, and leadership, and will be protected from isolation, discrimination, abuse, neglect, and exploitation. And so we really want to keep increasing life satisfaction as we age. I did look up the life satisfaction in Santa Cruz on our data dashboard earlier this morning, and it is around 63%, which is slightly below, I believe, the state average, just slightly. Our strategies in here are inclusion and equity in aging, and the Department of Aging actually takes the lead on most of the work in this goal area for the first 2 years, and then closing the digital divide. I'm sure you've all heard a lot about that. We really need to get broadband access across California, really for all Californians, but particularly as we've seen older adults who are isolated, they needed some more, we needed more tools and resources for them to be able to connect to their healthcare providers or their loved ones, their caregivers. Opportunities to work. So a lot of folks want to work, you know, after they're 60, 65, and some really need to still work. So in here, we have some strategies related to preventing, sort of fighting ageism in the workplace and promoting the ability for older adults to continue on in the workplace if they so choose or need. And then this cross-generational component is really important. There's a lot of work out there being done to engage folks across generations. It's beneficial for older and younger people. So we really want to do some work on that, make sure that while older adults actually, they volunteer a lot, but there are ways we could actually make it more welcoming if we took those broader, those larger volunteer bases, like AmeriCorps sort of style of volunteering, and actually had some targeted outreach to older adults and ensure that older adults are actually welcomed and encouraged to apply for those sorts of positions and maybe are put into intergenerational opportunities. That will be phenomenal. Protection from abuse, neglect, and exploitation. Really important issue, and we have just begun working on the development of our California Elder Justice Coordinating Council. So CDA and California Health and Human Services will be taking the lead on pulling together agencies and departments across California, as well as advocates, nonprofit leaders who are working to end abuse, neglect, and exploitation of older adults. Do a good landscape, find out what's going on out there, and really leverage each other's resources, have this coordinated response to the various types of abuse and exploitation that unfortunately are occurring. And then California Leadership in Aging, also a lot for the Department of Aging in here. You may have seen it's in the budget revised that just came out. The governor has asked for a senior advisor on aging and Alzheimer's disease to be at that cabinet level. That would be the first time there'd be a position of this sort, so it's very exciting. That's just one initiative within this strategy. And I want to plug our Equity in Aging peer-to-peer webinar series. This is something that CDA coordinates. We have done, I think, 8 of them so far, and they're the first Wednesday of every month from 10 to 11. This is one of the initiatives in the master plan, is for us to continue providing this sort of education and technical assistance to locals on how we can ensure that we actually have culturally responsive services and programs with and for older adults. And then the goal 4 area is caregiving that works. And it's that we will be prepared for and supported through the rewards and challenges of caring for aging loved ones. You know, our target here is 1 million high quality caregiving jobs. We really do need 1 million new high quality caregiving jobs to meet the need of older adults over the next several years. So we really want to ensure that we're paying people, training people, and supporting people in these roles, and ensuring that we actually have career pathways for them. So if they want to move on from being a personal care worker into becoming a nurse or moving further along in that medical field, that they have that opportunity to do so, to really turn this into a career. Then we also included, though, family and friends caregiving support in here. So there are initiatives in here like providing paid family care leave for those who need to care for older adults or people with disabilities in their homes. And then expanding that virtual care, like I said before, it's related to the digital divide, just ensuring that we are able to provide health access and caregiving access virtually when in person is not always available or really necessary. And then goal 5 is affording aging. And the goal here is that we'll have economic security for as long as we live. We really want to close the gap in and increase elder economic sufficiency. So strategies in this area are ending homelessness for older adults. You know, renters age 50 and over are the most at-risk folks in California right now for homelessness. And if you're living and aging on the streets, you're generally about 20 years older biologically than chronologically you should be. Income security as we age is the second strategy. So we want to ensure people are able and motivated to invest in their own retirement and make some changes in our pension system. And then protection from poverty and hunger. And there's a lot of initiatives in here related to CalFresh, ensuring that folks have a more streamlined access. We do have a low older adult participation rate in CalFresh compared to the rest of the country. So of course, those who are eligible, we want them to access CalFresh, but longer term, bigger picture, we want them to not need CalFresh. And then, so those are our 5 bold goals. We do have this data dashboard on aging. And in this dashboard, you can access data locally or data that's available at the state level. In January, we released version 1.0. I feel like it's probably version 1.4 at this point. We've added some new indicators. So we're continually updating and enhancing this tool, which we hope is going to be a very valuable resource for locals. It's not just to monitor the 10-year progress of the master plan for aging. We built this out with the hope that locals and state leaders could use this data to actually inform their policy and program planning. Here I've put on one slide all of the data that we have available locally. So not every measure on the master plan has local data available. And if it's available, we are probably posting it. There's some limitations when it comes to sample size, et cetera, and really who is collecting what at the local level. But you can see we have tons in goal 2, health reimagined, and tons in goal 3, the equity and inclusion goal area. Really working hard on getting more housing data. That's been a little bit more complicated than we thought. And so I will go ahead and share. This is what it looks like when you go on to the front page of the Master Plan for Aging's data dashboard. So the first thing you'll see is actually those 6 rectangles that were on a couple slides ago that outline the 5 different goal areas, because the Master Plan's dashboard is organized by each goal area. But if you scroll down a little bit, you'll get to the demographic data. And so if you go ahead and select years 2014 to 2018, and I want to point that out because it's tricky to get your local data. We have to aggregate the years. So you have to do a year aggregate. I circled that in green right there. And then you would just select Santa Cruz. And so this is the demographic data for those 60 plus in Santa Cruz. And this is a nice thing for locals you might want to bring to your board of supervisors or whomever you're trying to make the case that you need to do an age-friendly project. You've got your demographic data right here at the ready. We are adding sexual orientation, gender identity data to this page quite soon. And this is just a snapshot of what it looks like. This is an affordable housing indicator. Sometimes, you open up the indicator and you'll see the map of California with all the counties, and then you'll see each county with just one particular indicator listed. Or you might go ahead and see a map and you can hover over your county and a pop-up box will pop up to share a lot more detailed data if that's, within that particular indicator. We do have a lot more information available. So here you can see this is actually service gaps within Yolo County. And then the Master Plan for Aging Local Playbook, the reason you're here. Real excited to have created this resource for everybody. As you know, it has 7 plays in it. You can download the PDF or you can just use it on the webpage. The webpage is more comprehensive than that PDF though. But we did want to make that PDF in case folks wanted to just give presentations. So I just pulled this up randomly. This is play 4, which is select your Master Plan for Aging initiatives for implementation. You're going to talk about that later today. So if you wanted to do one in goal 1, housing options as we age, you can go ahead and click on which one of those strategies you want, and you can see it opens up. So I selected transportation beyond cars, opened it up, and those are all the resources that I found to be really helpful for age-friendly planning. If you have any recommendations to add to this playbook, you can always just email me and let me know. I did a lot of researching and vetting of what I felt were the best or top-notch resources for local age-friendly planning. No surprise, AARP is all over the place. And then next steps. So we continue to work with the cabinet work group. So we have been working throughout this whole process with the 10 agencies within the governor's cabinet. We've been working with the secretaries, and then plenty of deputies and chief deputies of departments within some agencies. And that's who ultimately determined what the 132 initiatives that we ended up with would be. So we went from those 800 recommendations to the 32 or the 23 strategies and the 5 goals. And then just for this first 2 years, we have 132 initiatives. That's not the comprehensive master plan. That's just what we've committed to do at the state level for the first 2 years. It's not necessarily all we're doing, but it's the specific commitments. And then of course, we're relying on our partners to also take those strategies, take this playbook and run with it at the local level or other levels. So we do have a new stakeholder committee being announced very soon. It's called the Impact Committee, and they'll advise the administration on the implementation of the Master Plan for Aging. We also recently recreated the Olmsted Committee. It is now called the Disability and Aging Community Living Advisory Committee, just called Community Living Committee. We also reformed the Equity Work Group. It's now the Equity and Aging Advisory Committee. It has the same members as the Equity Work Group, but we are going to be recruiting 5 new members to ensure that we really do have representation of the diversity across California. And then, as I said, we do have that Elder Justice Coordinating Council launching fairly soon. We've just started bringing together folks from across the different departments for some pre-work on that. And then, as you all saw, we have the governor's budget investments. The May revise just came out. Can't wait for the June one. Can't wait for it to finally get signed. Lots of investments in aging there. And then I also have linked here, and I can share this PowerPoint, state legislation related to the Master Plan for Aging that one of our partners, Justice and Aging, compiled. So yeah, there's probably about 30 different investments related to the master plan for aging in the budget. We've got falls prevention and home modification, community care expansion. There is expand Medi-Cal health to undocumented older adults. We have also the Office of Medicare Innovation and Integration launching soon. Let's see, in goal 3, we do have money to help older adults recover from the isolation they experienced during COVID. And then we also have the Aging and Disability Resource Connection, or the No Wrong Door massive project that will happen across California. Very exciting to have a more simplified way of people accessing resources. Language access, we have long-term career pathway money in here. So there's so much, lots of homelessness and CalFresh money as well. So check out that budget. It's really exciting. We also get $3.3 million at CDA to hire folks to help me implement the master plan for aging, which is very exciting for me because I'm the only person on staff right now. So that'll be just a fantastic day for me when I get to hire folks. And then just thinking about some local opportunities for folks. AARP's Age Friendly Network, of course, exists. California is joining that. In a few days, hopefully an announcement will come out that we are going through the process of joining that Age Friendly Network and will be the 8th state in the country to join. There's so many issues you can work on, and you'll go over those later today. And also just at the state level, we are taking a look at the governance structure of the area agencies on aging with stakeholders. And we're modernizing and streamlining CDA and those area agency on aging operations. So just tons of exciting work, MPA and aging going on. You can learn more about the MPA, of course, at that website. You can sign up for our newsletter that I hope doesn't come out too often, maybe once a week, maybe every 2 weeks. And then you can send emails, comments, questions to that email address down there. That is what I have prepared to share with you today, and I'm happy to take questions. I can also if there's a chat, I can pop things in the chat if questions come in via there.
Great. Thank you, Amanda. That was great. It was wonderful to hear all the great work that's happened and that's going to be happening. I think we're set up very well to use this opportunity. And, anyone who comes to speak with local folks and says, check out that budget, it's really exciting. I just wrote that down. That's a very cool thing to hear. So thank you for, bringing some information about what we can do and also, what the resources are looking like. Always an issue. In my enthusiasm to introduce Amanda, I did not ask members of the AAA who are here to introduce themselves. So I want to just make note of that and do that. But are we going to take questions now, Clay? I'm not sure that we have. Are folks sending questions? I guess I'm just asking, are folks sending questions your way to get answered now, or are we doing that at the end?
We're doing it in 2 sections. So right now, any questions of Amanda appropriate? Yeah, if you want to introduce the advisory council members first, that would be fine. One question popped up in the chat, so people can post questions in the chat, and Britt and I can or you can facilitate that. You can see those. But let's do the intros first, and then people can also raise their hand if they want to be called on. So either way.
All right, so it's very much my pleasure to introduce or allow the members of the AAA who are here to introduce themselves. I can only see some of you, and the participant list is, I'm happy to say, so long that scrolling through, I want to make sure I get everyone. So I'll just leave it to you all to introduce yourselves, maybe starting with Jack Dillis. I see that you're here, and as vice chair, maybe you can start us off.
Okay, great. Yeah, my name is Jack Dillis. I'm a city council member for the city of Scotts Valley, and I'm joining this presentation and look forward to hopefully lots of good implementations of the great goals here in the plan.
All right. Lowell, I saw you. Are you there? Maybe not. I see Bruce. Bruce, do you want to jump in and say?
Santa Cruz County Supervisor Bruce McPherson. I'm in my 9th year on the Board of Supervisors, this year as chair, but became very much interested in this several years ago, and expanded with the communications with Clay. And I just want to say how impressed I am when you have 800 issues and you've pinned down to 5 goals that are more understandable. It's just really a remarkable achievement to begin with. But it's really great that the energy and the enthusiasm from the state level and the governor's office and so forth, having a cabinet level person is very, very important, and because that's what gets the governor's ear day in and day out. So thank you very much. Very, very impressive presentation. Thank you.
Thanks. And I do want to just let regarding your comments, the cabinet work group, those members were phenomenal to work with. It truly was sort of, they mentioned like master plan for aging was the bright spot during COVID for them. It was the one positive thing they got to work on. So it was very enthusiastic engagement, and it's been just one of the highlights of my career to be able to elevate this issue and just have it be so widely accepted.
You know, I may have to skip off a little off and on. I've got a couple other things, so I apologize for that. There is the biggest issue, if I can just ask a question. I know we're introducing the issue on housing. That's going to be probably the most difficult goal to achieve. I know the governor, the state has these ideas about how much housing needs to be built per year, and we can't get a fraction of it all, and the housing costs are here so big. That's going to be a huge challenge, and I don't know, that's the one I see as the biggest challenge that we have, especially in a county like Santa Cruz, where the average house is now $1 million or more.
Yeah, it's the #1 issue we hear about. It's absolutely, we have been talking nonstop with different groups like Strategic Growth Council. Of course, we work closely with Housing Community Services Agency. Yeah, there's a lot of work to be done there, and to make older adult housing affordable is, obviously an even bigger task than just building more housing. And so there's things that we can do, like the formulas for affordable housing for seniors. Seniors are actually dinged because they don't drive as much, supposedly, and so that gets weighed into how many points different sorts of residential approved projects receive in order to get funding. So we got a lot of little like regulation policy formula work to do, and then you have, much bigger.
And I was really in the equity and inclusion, the broadband expansion with the fires we've had here in Santa Cruz County and throughout the state, the importance of broadband. And I think the governor put $7 billion in his proposed May revise. Communication is so important, and I'm really glad to see that's included specifically. And just want to say again, thank you. It's very impressive presentation, and I think we have some opportunities here for some good things to do for our aging community. Thank you.
Yeah. Thanks.
And Bruce, if I could jump in just for a second, you're asking really difficult questions, and that's why you and Colin and Greg are here, because they're questions beyond what we can do at the AAA. So, really happy to have you address those right up front. And, obviously in the second half, we'll start doing the work on how we come up with some projects.
All right, thank you. So I'll just keep moving through here, and everybody's kind of popping up and disappearing. So I'm going to do my best to find you. Okay, Supervisor Caput, I see you're here.
Thank you. Yeah, what I saw is, thank you, Amanda, for your reports. Very, very well done. I saw income security and economic security. I think that's going to be a big issue, especially for people that are where their main source of income will be Social Security, and maybe they don't have a pension, or they don't have some other savings or stocks, bonds, mutual funds, and things like that. So California is becoming, and has been becoming for many years, a very expensive state to live in. So I think that's going to be a big issue.
Yep.
Here, here. Okay, let's see. Everybody's jumping around. Lisa Berkowitz, you're here.
Yes, hi, good morning. Amanda, thank you so much for the really outstanding presentation. My name is Lisa Berkowitz, and I'm a representative of Community Bridges, Meals on Wheels, and I also represent the service providers on the advisory council.
Thank you. Okay, next up, Mark. I see Mark Johansson's name.
I'm Mark Johannesson, member of the Santa Cruz County Senior Commission and the at-large member on the council.
Thanks, Mark. Chuck, I think you're still here. Chuck, are you there? If you're still on mute. You're still on mute, Chuck. Can we, could someone unmute? So Chuck Molinar is here. He represents, are you there?
I'm here. Can you hear me?
Oh, yes, now we can hear you.
Yeah,
Thanks.
you can hear me. Okay.
Yep.
Anyway, Amanda, thank you very much. That was a great presentation. I am a member at large of the Area Agency on Aging and also a senator in the California Senior Legislature. And I love that presentation.
Thanks.
Yes. Okay, now I'm scrolling. So if there's someone here who I have not called, please jump in and introduce yourself as I look for more.
I'll go ahead. This is Colin Kosmicki, San Benito County Supervisor. I'll just echo a great presentation. It was clear and concise, very complicated issues here. So thank you for boiling that down. I would recommend sharing the presentation, if not the entire forum. You know, I'm not sure if we have it on social media. I know we're doing Zoom, but I'd recommend sharing, you know, at least the presentation to the public at some point. I'm just really excited that the state is prioritizing senior issues and planning for aging. And I really appreciate that there's a focus on all age groups because everybody, hopefully we all get to that point where we're senior citizens and aging. And so just really looking forward to the implementation, obviously, is the key here. We just want to make sure that equity remains a core priority. And I was excited to see that issues like parks, where we don't often incorporate senior planning into parks, I thought that was clever, and I really want to see that go forward. But just thank you, everybody. Thank you, Amanda, for the presentation, and excited to see this implemented.
Thanks. And I should have mentioned, we have our progress report, our first progress report coming out within the next couple weeks. And so you'll be able to see a lot of the work, and it's broken down by goal area, so you can see what we've been doing so far, because a lot going on behind the scenes. Yeah.
Great. So much energy. I love it. Okay, I don't see anyone else in my scroll, but I do see a city council member from Watsonville, Rebecca Garcia, is here. So if you want to introduce yourself, Rebecca, you can be the Watsonville rep today, and with Mr. Caput, Commissioner Supervisor Caput.
Thank you. Yes, my name is Rebecca Garcia, and I'm a native of Watsonville and have been on the city council. This is my 7th year. Last year I was mayor, and I really appreciated the presentation that came to us last year, which is what got me interested. And I'm a senior citizen also. I'll be 74 next month. And so everything that's being done with a master plan is going to have an impact on me personally. So thank you, Amanda, for that presentation.
Okay.
And Sandy, Rick Perez is here from the city of Hollister. He's another advisory council member.
Great, thank you. I didn't see you, Rick. Please do introduce yourself.
Morning, and yes, thank you, Amanda. That was very informational, energetic. I really like the part of the cross-generation engagement and the intergenerational engagement. I love those words, first of all, but the whole aspect and ideas behind it is awesome. Yes, I am a city council member from the beautiful, wonderful city of Hollister, and thank you for letting me participate.
Great, thank you. So I will open it up now for questions for Amanda. I just want to say before I do that, so everybody who's on here, these are the folks who are at least part of the decision-making process at each of our respective jurisdictions. So you've heard us here today, and we're the folks that we want you to reach out to around these issues and how we can support you at the government level. And now I'll open it up. I see we have some questions and comments in the chat, and Clay, or maybe if you've gone through them, please feel free to field and I'll jump in.
I'll pick one out that was the first one that was asked, and just for all the participants' knowledge, if you haven't looked at the agenda, I did post the agenda in the chat so you can download it, and I also posted the actual master plan. It's about 40 pages. It's just full of information, as you can imagine. So if you want to see all the details of what we're talking about, it's available there. And all of this will be posted on our website in a day or two, including the event itself. We are recording it, so we'll have the full recording. It'll be lengthy, but you can, jump ahead to different pieces of it. So the other piece that I just want to share is we're going to do about maybe 10 more minutes of questions if we have that many. And then what we're going to do is switch into what we want to do locally to support the master plan. And we're going to kind of go through the same, well, I'll talk about that when we get to it. So that's coming. So right now, make sure that your questions that you have for Amanda get asked, because I think she has to hustle off, but and I also want to just echo how great her presentation was. So the first question that was in here was to ask where the data on LGBT adults, older adults specifically, is coming from or being gathered from.
I don't know. Most of our data comes from the California Health Interview Survey, so it's a lot of CHIS data. We have American Community Living Survey, and a whole slew of other sources. So I'd actually have to check with our data dashboard guru. We have a consultant named Terry Shaw, and she's absolutely phenomenal. She's been working with the California Department of Public Health, who actually partnered with us on developing the dashboard on aging. So I might be able to text her, and I could just put that in the chat in a few minutes.
That would be great.
Yeah, and just another point on the dashboard is that you will see that the CHIS data that we have, I believe it's 2018. So we are getting the 2019-2020 data very soon. So those updates will happen pretty soon. And we are working with UCLA right now, Catherine Keatsman and her team, to help us with building out our data dashboard as we build up capacity within CDA to do it. Because right now we don't actually, we've never had a data shop. And so thanks to the new budget, we will have a data shop soon.
So Rick Perez, Rick has his hand up.
Oh yeah, just you mentioned something about how you want to get to the 1 million workers in the caregiving. Do you know where we're at with that number? And is there a shortage of healthcare workers for our seniors?
Yeah, so I have actually read that we are short by 1 million, but I recently heard that it's 688,000 is what we currently need, or it's 866,000. I'm a little dyslexic with numbers. That's why I'm not in charge of the dashboard. So we have extreme shortage of direct care workforce. And then what we'd really like to see, and if you go back on, actually it's in the playbook, we have our local models that we thought are doing a fantastic job in developing a workforce that can serve older adults and older folks with disabilities, is healthcare career pathways in Contra Costa County. Nicole Howell, who is the long-term care ombudsman up there, has been a strong advocate. Perhaps she even launched this fantastic program, and it really takes some non-traditional students and trains them to be caregivers, but then ensures that they kind of are able to like climb a career ladder in the healthcare field. So, you know, we have such a treasure with Julie Sue, and with her going off to join the Biden administration soon. I mean, it's great for the country, but it's a loss for us. She's been very enthusiastic about improving and increasing the caregiving workforce in California. So looking forward to meeting her successor and working with that agency to develop additional caregiving jobs.
Thank you.
Robert Ratner has a good question with a little background, and it's many of the proposed strategies and goals overlap with plans to prevent and end homelessness. How are these efforts and plans getting coordinated at the state level, and how can we support better linkages at the local level?
Yeah, well, that's one of the beauties of the plan, like the master plan for aging, is that we are inherently coordinating across different departments. We have a fantastic relationship with the Business Consumer Services and Housing Agency, as well as been working closely with Department of Social Services on their housing and homelessness branch. So you'll see in the governor's budget proposals a lot of money that goes towards housing, a lot of programs and projects. Recently, the California Department of Social Services even hosted a full-day forum, it might have even been 2 days long, on ending homelessness for older adults. So it's an issue that we've been elevating and definitely has been catching on, that housing and homelessness, it's absolutely, I mean, it's a crisis, and you know, everyone is aware of that, but I think we often don't think about older adults. We think a lot about youth, but with older adults being more vulnerable right now to homelessness, and how awful it is if you have a chronic condition or Alzheimer's disease or dementia living on the streets, is a really miserable condition to be in. And so we need to prepare transitional housing. We've seen a lot of success with Project Home Key, projects like that. So one of the initiatives in the master plan is to expand projects like that, where we're buying hotels and using those as bridge housing. Right now, what we've actually discovered is, you know, there's a continuum of housing needs for people as they age. And so you have people who want to continue to live in their homes that they already have. And then you have people who, you know, their various needs of, you know, assisted living to ending up living in a nursing home or being institutionalized. And then you have homeless folks. And so there's not one cohesive plan or strategy or not even a paper that actually outlines this continuum of housing needs. And so that's one of the things we're actually working on right now, is really focusing on what are people's housing needs in California as they, you know, turn 60 and older, because it can change, you know, by your decade. And some folks live alone, some folks live with families, some folks don't have a home. So that's one of the things we're working on right now with our partners, is to really like outline and determine like, what's everyone doing? How do these overlap with each other, and what partners are involved? Who are the major players, and how can we collaboratively work together to develop a whole continuum of housing for people as they age?
So a couple more questions in the queue. If anybody has one to ask, you should you know, get in the queue right now. We've got Mark Johannesson has had his hand up for a bit. So Mark, you're on.
Yeah, thank you, Amanda. So just a question, when we're looking at developing a local playbook and action plan, to what weight or extent should we, or I don't know, if we should consider the 100 initiatives that the state is taking on for the next couple of years out of the 800? Is there any benefit to tracking those in terms of funding or momentum?
I guess that really depends on your strategy locally. If you want to leverage what's going on at the state to convince a funder or an elected official or whatnot to get on board, and you want to say like, look at, you know, the state called out this specifically, that might be to your benefit. But at the same time, like, I mean, a lot of them aren't going to be relevant for your local implementation. So I think what's most important is really just to do an assessment of your community and identify what the greatest needs are there. They're clearly going to fit within a goal and a strategy. So I think just aligning yourself with strategies is probably the way to go, and looking to the state to see, you know, where the leaders up there have identified priorities, just as a way to communicate it and further make your point that this is a priority need.
And Jack Dulles asks, will the state master plan data dashboard be used by the state for funding allocations to help the neediest seniors and jurisdictions?
I do not believe that it would specifically, there is no mandate to use the dashboard for funding allocations. Our hope is that it will become a resource in making those decisions, but not necessarily required.
Yeah, I would just add to that, just to build on what Amanda said, because in trying to leverage state dollars, having data readily available is a huge challenge. So having the data dashboard will be just a great place to kind of go and pick issues that are critical or that somebody's trying to support and say, oh, here's all the data in one place. We can find it and share that with electeds and get some leverage for what we're trying to do. Lowell Hurst has his hand up.
Thank you very much. A very interesting presentation. I really like the dashboard a lot too. I think for policymakers, having reliable data is really important, and understanding where the duplications occur and where they don't occur. And so whatever refinement can be done with the dashboard, and whatever, authenticity that we can make sure that we're getting accurate information and real information, and how it fits in the broader scope of things as well. And so it's a powerful tool. We just need to make sure that it's up to date and full of knowledge. Policymakers can use that, Thank you.
Yeah, for sure. And want to point out that we added 4 tutorial videos on how to use the dashboard. It's a little complicated. So we have, if you go to the MPA's page, the one that's actually Britt just put up there, you'll see that we have some YouTube videos that we posted that take you through how you would access certain data.
Any last burning question for Amanda? All right, I think we got through them all. Amanda, great job. Really, appreciate it so much, and you spending the time with us.
If I could,
yeah, go ahead.
I just see a question. I think I see a question. What about a common communication vehicle for interagency referrals and follow-up?
Well, common communication vehicle. I don't know that there's anything specific about the communications. I think that has to be part of a lot of the other efforts where we have like building out the no wrong door system. So that should, I would hope that people would create a communications tool. So I think that in essence is included in that no wrong door, or the ADRC project that we have happening over the next couple of years.
Thank you. Thank you so much. And sorry to cut you off, Clay. I want to get turn it back over to you to take us through the second half of our meeting today. And I don't think Clay needs much introduction, but I'll just say at the AAA, we just started taking to saying BC is before Clay, when we're trying to think about the longer histories here, and kind of the structural and institutional histories that bring us to the decision points that we make today. So I will turn it, and we're so lucky to have this champion at the statewide level here in our local community. So I'll turn it over to you, Clay.
Thanks, Sandy. So I'm going to share my screen in a minute, and may as well do it now, I think. So I'm going to do a slideshow also, and you're going to see a lot of the same slides that Amanda presented, but what we want to use them for is to come up with what our local plan is. And thanks, Amanda, for sharing the PowerPoint where I can edit it and so forth. So let me jump into that. Let's make sure I open up the right one. And hopefully everybody can see this. Just give me a thumbs up that it's up.
It is.
All right. So you saw this one before. What we want to do is develop kind of in conjunction with the master plan, what we want to do here locally. And this is going to be interactive as we go through. So Amanda pretty much gave us an overview, but a second tool, if you go to the master plan website, is a equally valuable and thorough document on how you turn the state plan into a local playbook for delivering services in our local community and building on what the state has done. And I think it's just really exciting. For years, one of our advocacy mantras has been that our goal is to elevate the conversation about older adults and people with disabilities. And the master plan is doing that for us. So we've gotten there, and it's time to move forward, and just so excited about that. So this is what the local playbook consists of. And we're going to spend a lot of time on play 4. Creating our local initiatives. First thing we all have to do, I think this is a nice chart for what the process is. Engage your local leaders, explore local data, review existing local agency models, select our initiatives, build our action plan, evaluate your initiative. It's easy to have a plan. It's another thing to see whether or not you're doing any good with it, so that evaluative process is really critical. And then stay connected. And as Amanda shared with us, this is a 10-year plan. So we don't have to solve everything today or even in the next 12 months. We hope the plan in our local plan evolves based on the need and the responses that we're putting in place. So we all know that everything works better in partnership. And the more we can engage each other, which hopefully today starts that effort, the more success we're going to have, the less duplication, and the more not only aligned resources and amount of resources, but the more effective those resources will be if we're trying to all as a group do the same thing rather than all do separate projects accomplishing the same thing. So right now we have a pretty good jumpstart on engaging our local leaders. Obviously, the AAA is taking a key role in this and has been involved from the start and wants to continue to put our time and effort into doing that. We have supervisors from both counties engaged, and 3 are here today. We have 6 city councils involved, and city council members actively engaged in these discussions. Local grant makers and foundations are a big piece of this. Santa Cruz Community Foundation is present today. And of course, older adults and people with disabilities. We want to engage the people that are receiving services. And the disability community has a great saying, and that's nothing about us without us. And I think that should filter through everything we do and part of it to make sure that those receiving services are part of the process. We want the business community to be here, and of course, service providers. So this question, think about this. What leaders and organizations are missing? We're going to ask this question in another way throughout the next hour. Who's not here that should be, who is here that should be, and what type of role can they take, and how do we engage in moving forward? So anyways, play 1, engaging the local leaders. Let's get people to the table, and that's how we're going to actually move the issue. I jokingly called out Bruce and Colin and Greg earlier when Bruce was talking about housing, because that's such a huge challenge. And no one entity or agency is going to be able to do that alone. Certainly as the AAA, that's beyond our ability, unfortunately. So hopefully we can be a catalyst for the issue moving forward. Play 2 is explore local data. And I think we had a great overview of the MPA data dashboard. I think that will be a great resource for the state and for us locally. Also, the AARP Livability Index and the Elder Economic Security Index tells us how we're doing, how expensive it is to live here, and whether or not our local seniors have the ability to pay our cost of living as opposed to federal poverty level. And we'll talk a little more about AARP Livability Index. Also, I want to highlight that every 4 years we do a needs assessment. So the findings of our needs assessment are on our website. And then each year we try to put out fact sheets about what's going on with the seniors in our local area. We do one for San Benito County and one for Santa Cruz County. Many of you have seen that. Elder Economic Security Index. I don't want to go through too many details because I want to get to the interactive part. But as I mentioned, this is a way down to the local level that we can measure what the true cost of living is in our communities. And AARP Livability Index is a great, fantastic tool to see how well or how poorly our communities are doing in the various livable communities categories, and some of them are posted on here. These can be looked up on a county level, a state level, a city level, or even a neighborhood level. So if you want to find out how housing is not available for the most part in your local neighborhood, you can use the AARP index. We've talked about this in the past. We had a presentation a couple times in the past few years about livable communities and age-friendly communities. But I just want to highlight that it's a tremendous tool for exploring local data on a variety of categories. And then I wanted to share these numbers. This comes courtesy of Department of Aging and California Department of Finance about how our local population is changing. And this one always, these first two bullets always jump out at me. That statewide over the past decade, the 60 plus population has grown by 40%, and the 0 to 59 population has grown by less than 1%. So in terms of priority of need, it's clearly older adults where there's a large increase in population. Locally, it's even more dramatic. It's 48% growth in San Benito County and 58% in Santa Cruz County. So tremendous increases in demand. I think those of you who are here who are trying to provide service are well aware of that, but we want to make sure the entire community is aware of it. We feel it's often overlooked. And then 20% of all Californians are now over the age of 60. And this last one, this comes from Santa Cruz County homeless surveys, that there are twice as many homeless people over the age of 50 as there are under the age of 25. Yet every time I read an article about homelessness, there's an emphasis on how many young people are homeless and almost no mention of older adults. That's got to change. So age-friendly models, we've talked about starting age-friendly communities locally. That's been a slow process, but a lot of the things in the master plan match up very well with age-friendly communities or with livable communities. And that's, you'll see that throughout the master plan itself. And it was a huge part of the discussions that we had in the Stakeholder Advisory Committee, where we would try to address, you know, a certain issue, be it housing or transportation. And we kept coming back to how well those issues are spelled out, or at least opportunities to address them exist in the age-friendly model. And here, CDA shared this, samples of some nice age-friendly plans. Part of why I kept this in here is because the first bullet, West Sacramento, California, the primary author of that was none other than Mark Johannesson, who's on our advisory council. So shout out to Mark for the work he's done there and just the skill he brings to our community should we get busy on an age-friendly model. So this is where I really want to, open up the discussion a bit. Is now I see us going through the 5 goals and the 23 strategies that Amanda laid out for us. So we want to revisit those, and we're going to ask the same questions on each one. What are some local projects that we should be engaging in, and who are the players that can help move that forward? So what we're going to do is I'm going to, pull up each of the strategies. You've seen these before, listing, what the strategies are, what the 5 goals are, and then our next slide will show a local project that we have going, and then we'll talk about what sort of things should we engage in. So one of the things we want to do is share a poll. So we can fill this out either now or as the discussion continues. Excuse me. Let me go back to, I clicked the wrong button here. I got to start. Sorry.
Clay,
So
I'm
housing
happy.
for all ages and
I was just going to say, Clay, I'm happy to post the poll whenever you think it's appropriate, and just let me know.
Yeah, why don't you go ahead and post the poll?
We'll give people plenty of time to respond too. You can put it in the corner of your screen and still watch the slideshow.
So the poll is essentially asking which of these 5 goals do you think are most important that we work on or that touch your life? The poll's anonymous, so don't feel like you're committing to, working on a project. A question that I have for local example is, do we have older adults in local housing elements or in homeless service plans? And far too often they're not. It's great to have Robert here from the County of Santa Cruz, because I think part of what we need is engagement of people like him. Robert's new to the community and going to be a key player in addressing housing and the unhoused population. So I'm going to stop talking and just, leave it to the participants to throw out some ideas about goals and projects that we can engage in.
This is Britt. I guess I recall from the chat earlier, Jane, that you had made a suggestion about the need for caregiver housing and different sorts of housing visions to support an aging population. And I wonder if you would care to expand on that, and maybe that's something that we could include in our local list of priorities.
It's the co-housing model that's been explored in Europe mostly, but we've got 2 co-housing units already in Santa Cruz County that I know of. There might be a 3rd, but I've always wanted to participate in some way in building a co-housing community for older Americans that would engage maybe 12 units, one of them being for a caretaker, and their smaller living housing situations with a larger shared community space, so that not everybody has to have a computer room. They share that in the main space. They share, yard tools. They don't all have to have them. It's a wonderful model. It was actually a book that I read by 2, I think, PhD students out of Berkeley, probably 20 years ago. So I would just love the community to look into that. It is hard to build in Santa Cruz County when you're doing something that hasn't been done often enough. So I just want to throw that out there and keep it in everyone's mind as an option.
Thanks, Jane.
This is Wayne Norton, a member of the Seniors Council Board of Directors. And I live in San Diego County, and I have a question, I think, for Colin Kosmicki, our San Diego County Supervisor, and also Rick Perez, the Hollister City Councilman. You know, I know, Rick, right now that Hollister City Council is undergoing a general plan review and updating this general plan. And I'm wondering if housing for seniors has been included or is being included in your discussions. And Colin, I'm trying to remember if we have in our county general plan, if we have any language about housing for seniors. If we don't, we should, and that's something that we can, that's relatively achievable.
If I can respond?
Yes, please.
Of course.
Yeah, so I know that's as far as the city, it's part of the general plan. But what really stood out to me is the co-housing. That's something I really want to get some more information on. And Wayne, I'll be reaching out to you to give you some more information about that. Because I think that's like pretty much killing two birds with one stone to create more housing for our seniors and for lower income housing also, because I know rent is not cheap nowadays. So any options we can come up with, I'm all for it, especially to take care of our aging community.
All right, thank you.
Brenda Moss and Liz Hutton are both at the meeting, and they do coordinate some senior shared housing efforts, which echoes a lot of the things Jane was talking about. So maybe one of them would like to share something about that program, or maybe more importantly, how it can reach more people.
Thank you, Clay. This is Brenda. Yes, shared housing is a great, wonderful idea. We've been providing shared housing programs since 1985 in Santa Cruz County. And it's interesting because you don't have to build new units. It's a senior that has a home already that wants to share their home with another individual. And it's amazing that there is not very much financial support locally for senior shared housing. And, you know, we certainly have a small amount from Santa Cruz County and the city of Santa Cruz, but it started back in 1985 when Senator Mello supported the shared housing in the state of California. And so we were one of 8 programs in the state to start a shared housing program. And city of Watsonville supported it back then, and Santa Cruz City and the county of Santa Cruz. So it's a really great program. So again, some more support financial for that program would help it, not just our community in Santa Cruz, but also San Benito County.
Thank you. So let's see, I see that Robert Ratner has a hand up, and I just wanted to acknowledge Mr. Ratner as our new Housing for Health Director for Santa Cruz County. We are really lucky to have Robert on board, and we got a presentation last night at the City Council about all the amazing work that's been done at the county. And so, you had your hand up, and I see some information in the chat as well. Robert, go ahead.
Yeah, thank you for including me in the invitation, Alicia, and for all the work that you've been doing on this issue. And I really look forward to working with all of you in more detail on many of these agenda items. I really think there's some opportunities in the next few months for us to work together on Project Home Key as one example. So that's state funding to help purchase properties for housing folks experiencing homelessness. So I'm trying to identify potential locations where that's a possibility. And I think mobilizing this network to help generate some community support, because there will be, I saw in the chat, NIMBY. We need some YIMBY. So if we identify some locations for acquisition, how can we act? Because these are projects we could acquire and get online in 3 to 6 months to help address the housing issue. So I'm working on identifying locations, but I think piecing together the right support services for seniors experiencing homelessness would be something we could work together on as a network. And I also was struck by a comment earlier, and personally, I've had a lot of interest in the assisted living waiver with state Medi-Cal reform. I personally feel like the state has not done as much as it can around Medicaid and how it can help cover services and some housing related expenses with CalAIM. So I think that the assisted living waiver feels like a place where maybe we could collaborate on getting that program up to scale and making sure it's adequately financed for the different costs in different regions in the state. And I could go on, but I'm excited to collaborate on any number of the project ideas that the group really wants to mobilize around.
Great. Thank you so much. We will definitely be in touch. So let's see. I think that Mitch Matthews is up next.
Great. Thank you so much for including me in this. I'm really grateful. So much attention, and the right people here are pushing the right buttons in this. And my question, I'm not really sure it's a question, as a recommendation that one of the real success stories in our region has been Mid-Peninsula Housing and CHISPA that have managed to expand their senior housing, low-cost housing, seemingly without real impediments. They seem to be very successful at it. And what I would love to be able to see more is how we in our arena can leverage our influence to increase either the tax incentives or whatever it is that motivates these people to do these developments, because it's been very successful. I've worked with many people trying to get out of nursing homes that they could get out with assistance from the California Community Transitions Programs and other help, but there's simply no place to go. And this is common for everybody here. And thank you, Robert, for mentioning the assisted living waiver, which would also help. But what sort of incentives can we provide for developers like Mid-Peninsula Housing or CHISPA to continue that on, now that we have this influence with the National Plan on Aging?
That is a great question. Anybody want to try to take that one? It's very complicated, and housing production in a community like ours, or in a region like ours, is very challenging. So I'd love to hear others weigh in on this. Thank you, Mitch.
And I would like to maybe, I think these are all really great ideas, funding co-housing, looking at additional models for increasing housing, or certainly looking at assisted living. I think the question is, how do we take this to an action group so we can move forward on some of these ideas? And, who convenes that? And, who are the leaders that need to be at the table for it? So obviously, we want Robert there. I think the people that are raising the issues are all good participants. But who convenes it? We have tried to do this in the past and really have very poor participation and kind of gave up on it as a AAA. And it's really, frankly, not our role. So who's going to do it?
I think it's going to take all of us in one way or another. So thank you. Yes, I mean, housing is obviously a much bigger question, and there's a whole lot of institutions or layers of regulatory layers in land use and planning, but there's also this resource question. And I do think that it's important to just remind ourselves that in order to develop new housing, we do need to have resources for, and I think the state is beginning to step up, but a lot more work to be done there. And so we'll just keep on keeping on. Let's see, I think, sorry, this poll keeps popping up and covering everything. I believe, Mark, you're up next.
Oh, thank you. Do we have an idea on to what extent the zoning structure in the cities and counties in Santa Cruz either is an impediment to development of housing or can help support it in terms of density bonuses or housing near transit, that type of thing. Because I think ultimately the regulatory framework is centered around zoning and general plans. And one project might be to go through each of the cities and the county's general plan and see if there's something there that can maybe encourage the development of housing. I know that's a problem in the area. It's, density is a kind of a no-no in this area, but I think that's probably an action plan would be to get some type of zoning amendments or general plan amendments.
Yeah, I think this is a really important conversation, and Clay, I take your point about trying to bring some folks together to have that conversation. I do think that there are examples, and Mark, I can talk with you about what we've been doing at the city, and there are others as well. So, but it's definitely worth trying to have a targeted conversation about that and how we might be able to share best practices and ideas. Okay, so Mitch, I see your hand is up. Did you have something else you wanted to?
Oh, no, and I apologize. I didn't take it down.
Oh, that's
Sorry.
okay. No, I could have done that too. I think I have the power.
Sorry
Sorry about that. Okay, so John Balowitz, you're up next.
Hi, it's good to be here. And talking about housing, I think I have one real main comment, which is that it is important to have our elected leaders really leading us because they have the power. They're the ones who are involved in zoning. And for example, say a city like Minneapolis, they've gotten rid of they're allowing multifamily dwellings everywhere in the city. Those are the kind of big solutions we need. And while I'm really encouraged by things like, building co-housing or small things, that isn't going to help the major population. So I really think that this group, if it's going to get anywhere, has to be led by our elected leaders. And we really need to look at serious zoning issues like family housing, which I know is a dirty word, but if we don't do that, we're going to continue to live in a community where people like me who work in nonprofits retire somewhere else. And that doesn't even address the people who are homeless. We need we need something immediate for that, which again is money, and it's not easy. But again, I think going back to what Clay was saying, if this is going to succeed, I'm just going to say it, we need our elected leaders leading this committee, not people at the AAA trying to complain and bellyache. So I'll let it go there. Thanks.
So Robert's posting a link to a new group to organize efforts around this. So I think that that's really interesting. And yeah, I would love to get more information and see how we can all engage. So thanks, Robert. So I'm also cognizant of the time. I know this is a difficult goal and a big challenge for us. So I'm kind of giving it a little extra time. It's also the first one up, but I do want to move on. So Britt, I don't know, have you shared the results of the poll with everybody?
Yes, those have been shared, and I pulled those down so they wouldn't obstruct everyone's view. I have downloaded the results, so we can also share that back out through our website at a later date if people want to be reminded of what those priorities were.
Thank you.
So, it was interesting to me, housing, more housing options, no surprise that it's first, but I thought transportation beyond cars finishing second, that kind of fascinates me. And for those that have known me for a long time, in a former lifetime, I was a lift line director and very engaged in accessible and coordinated transportation at the state level as well. So, that resonates a lot for me. So seeing that there, I think is, like I said, pretty interesting. A number of us were disappointed with what's in master plan because it is kind of simple, transportation beyond cars. That's been the mantra of public transportation for 40 years. And I think that falls a little short of what we really need in addressing access for people with disabilities and older adults. And it ties in so closely with housing, as this poll is showing, because, you know, you can build services or housing, but if you don't have a way to get to them, they don't exist. So nice to see that rise up, and, you know, a little concern about it. So any last comments before we jump to the next poll and the next topic? And I can't see raised hands with this, with the slideshow up. So Brett and Sandy, I'm going to rely on you for that part.
Sure. Yeah, no, we do not have any more hands up. I think we're ready to move ahead.
Okay, let's jump. So Health Reimagined. So same question, what are our local goals and projects, and who are the local leaders? And just an example that, what happened there? All right, we're missing a slide on here, but one thing that we have, it'll probably pop up later, is, you know, we're doing falls prevention locally. And I think that's a great example of a different approach to health. To, you know, prevention is the key. And if we just look at the amount of dollars that are being spent on emergency response, and the drama and expense around people falling and going to emergency rooms and recovery from broken bones when that happens, we think this is one example of reimagining health in a way where we can keep our community much healthier and prevent falls from happening, and just redirect healthcare dollars in a way that is beneficial. So Chris is asking, what about funds for home modifications? That's part of our falls prevention program. So often when we assess somebody's home, or when somebody's responding to a fall, somebody has slipped in the bathtub, or somebody has slipped going up stairs at the entrance to their house because there aren't good handrail. So part of what our falls prevention program is about is exactly that, is minor home modifications. So
I'm sorry to interrupt. Do you want to take questions at the end of your presentation on this goal? I see one hand up.
I think we should jump into the questions right now, the questions and the ideas for solutions.
All right, Lois, you seem to have jumped off my screen, but it looks like Lois wanted to jump in.
I took it down when I thought we weren't quite done yet.
Clay's ready now.
Okay, great. Thanks, Clay. I just wanted to say that I think one of the things we really, really need to do is focus on keeping people safe in the community, and in the community, out of nursing homes as much as possible, because nobody I know wants to be in a nursing home. And I think, there are a lot of different ways to do that. Falls prevention is one big way. It's a huge way to do that. Also programs like Elder Day. We're the only adult day healthcare center in the county, and I don't believe there's one in San Benito County. No, there's not one in San Benito County either. So adult day healthcare and other daycare programs, not just day healthcare programs. There are a lot of different kinds of ways that we can support people being healthy and staying in their own homes. And I think we really need to make sure that we're supporting those projects as we go along, and looking for new projects in that same vein.
So Lois, I'm going to address that, because there used to be an Alzheimer's daycare resource center in San Benito County.
Yep. Great
program. It was kind of, it wasn't healthcare, but we made sure that we had some sort of adult day center in each county.
Right.
And during the Schwarzenegger administration, all funding, not part of it, but 100% of the funding for that program was eliminated, and it has not resurfaced. So in terms of like future projects, that would be a wonderful one that we could potentially work on restoring and reinvestment in.
Yes, absolutely.
Couple more hands are up.
Lisa Berkowitz, I believe you're next.
Yes, thank you. So the importance of access to healthy food and considering it to be an essential part of healthcare services, such as reimbursement for home delivered meals through Medicare.
Yeah.
Yep.
Absolutely.
Access to nutrition is a huge health issue.
Well, and Lisa, I'll just say, as the director of Meals on Wheels, working, tirelessly to ensure that. I just appreciate your being here as well. And I think food security is certainly another area that we can collaborate on, do some more work. Alicia Morales, I believe you are next.
Hi, everyone. Happy to be here. My name is Alicia Morales. I am the Director of the Division of Adult and Long-Term Care in the Human Services Department, and so happy to be participating in this launch, which is really, it's very evident from this that this is a huge effort that crosses all sectors, and we all need to be involved in at the tables. And lots of great points raised today. On this particular goal, Health Reimagined, I think for me, this is one of the most powerful goals under the Master Plan for Aging. This is, if we can do this right, this is what's going to truly allow our older adults and persons with disabilities to remain in the community and remain in their homes or in the community setting of their choice to avoid being institutionalized. And I just want to also echo how important nutrition is. Food is medicine, and we need to start getting that message out there. We have a lot of great programs here in Santa Cruz. I'm new to Santa Cruz in this role. One thing that's been become very evident to me is while we have these great programs, there's just not enough of them. And all of these programs are very categorical, which excludes so many of our older adults from having the opportunity to participate and really thrive in the community. And another thing that I would really love to see launched in our community is a PACE program that would help our older adults stay in the community, stay engaged, receive their health care, and have all of these intensive wraparound services to truly, truly age in place. So thank you very much.
Thank you. All right, I see applause, and I think, does anybody else have questions on this this goal before we reveal the poll results? Oh, actually, you're already seeing them. Clay, I'll send it back to you.
Yeah, I'm looking at the poll results also. I think everything's being listed as important. Bridging healthcare with home, that seems to be going up to the top, and that kind of goes to a future goal about connectivity. So that's nice on here to see. I love the ideas that are coming forth, and I know we're not having as much time to brainstorm as we would probably like. But I think what we will do is follow up as staff, and I'll jump to it now, is I want everyone to keep those ideas and suggestions coming forth. And at next month's advisory council, we'll have a list of what all of those are. We will also post it on our website, and then we can, maybe prioritize or form some actions going forward. A lot of these ideas are kind of big, statewide issues. So we've had a fair amount of success, as all of you know, about raising local issues to the state level and getting the state to do something like that. So I think that over summer, we should develop that list of state investments that we want to promote and see if we can, get some action on resources happening, and, talk to our local funders and various foundations as well, and see if, there's some matching funds for that sort of effort. So let's jump to the next item on here. Works better if I can use my clicker. So bridging the digital divide, and this is strange. Half my slides are not showing up. Oh, so one of the things that we have going on right now is there's a great partnership that Community Bridges has led about bridging the digital divide. They've created a Senior Center Without Limits program that is in partnership with our northernmost city, Santa Cruz, and southernmost Watsonville, and various other partners to just get digital devices in the hands of older adults or in the homes of older adults, and providing a lot of both internet-based and out in public programs and classes that people can participate in. So I think that's an example of things we're working on. Our San Benito County partners and some of us who live in North Monterey County, you know, are struggling with the digital divide around just connectivity. That rural connectivity and lack of rural broadband is a huge issue. So that's an example of some local projects that I think would be important on, and you know, state and local partnerships around bridging the digital divide is a big one. So you know, same question: what do we want to do locally, and who are our local leaders? And Britt's got the poll up about the 6 goals in this one that we might want to prioritize. And I'm loving the folks lining up to say, you know, you want to work on creation of a PACE project.
I was going to say that it's great to see the brainstorming and opportunities to work together in the future happening through this chat. So while folks are voting, Mark Johannesson, it looks like you have a hand up. If you'd like to jump in now.
Yeah, I just, I'm not sure, I haven't looked at the recent federal proposals for infrastructure, but I know there's a lot of effort going into digital divide issues there. So it may be an idea to, you know, again, try to coordinate what the federal government's doing and look for grant opportunities or what their focus is going to be in terms of providing digital access.
Yeah, I think that's a great suggestion, and you know, looking at how we could combine American Recovery Plan Act dollars, you know, towards digital divide with the potential contents of the federal infrastructure, and then you know, the state. There's maybe half a dozen bills right now about moving forward in closing the gap on digital divide. So if we could pull all those together and then look at the ways that we can tie into that locally, I mean, that would be a lot of resources to, you know, achieve something that would have a huge impact.
Absolutely.
Green cards for caregivers. That's a great idea.
This is Wayne Norton. Again, I don't have a mechanism to raise my hand. I'm sorry, Sandy. But one of the things that I'm discovering as I'm involved in digital divide broadband issues in San Benito County is that a lot of that federal and state money is going into infrastructure. And infrastructure is helpful, certainly in rural areas like ours. We really need it, but the problem is that even though more people will have access to broadband, there's no initiative to make it affordable. So the end result is that we're ending up having ISPs be able to make more money, but we still aren't going to be closing the digital divide unless we can figure out how to make it affordable to families who currently don't have it. You know, so you know, that to me is really the work for advocates for, especially for low-income seniors, is, you know, how do we, even if broadband is running in front of their doors, if they can't afford the service, then it doesn't do them any good. And if we're really going to close the digital divide, we're going to have something like a public option. We're going to have something like a lifeline rate for broadband. That's a real good use of some of this federal and state money that's coming down, instead of just making ISPs rich.
Great point, Wayne. And it is one thing that we're working with Department of Aging on. They have a pilot program out to address some of those issues. So we want to continue to engage in that. And, the more resources or having that lifeline internet, that is just so perfect.
Yeah, definitely. Alicia, I see you have your hand up.
Yeah, I just wanted to thank you, Wayne, for that point. And I think that also illustrates how all of these broad goals are so interrelated, because, the last goal is about financial security. And then we also have a goal that is about, not being isolated and staying engaged, which also speaks to training, so it's one thing to have the broadband there. It's another thing to give somebody a device, but how do they use it? So these are just great examples, these conversations about how all of these initiatives, all of these goals are so interrelated, and how comprehensive this plan is. So it's just very stimulating to have this conversation, and it's a great way to launch this plan, which again, for those of you who may be feeling overwhelmed like I am by how much there is to do, it is a 10-year plan. So I know that we'll get there together. So thank you.
Thank you.
Yeah, and being able to use the resources that you have, that's crucial. And what I think about this one is, yeah, it's great to give everybody a computer or an iPad or something, but if you don't know how to use it, it could be really detrimental. And I would love to have a helicopter as my way to get around, but if somebody gave me a helicopter, you wouldn't want me to go out and jump in it and fly it and start trying to get places with it. It would be, I'd kill myself and who knows how many other people. So while giving somebody a computer might not lead to them killing themselves, they certainly need to have that training in how to use it. And I think it really highlights some of the important aspects of making sure that we have educational programs for older adults, especially around technology. And Lois is talking about some of the things being done with Senior Center Without Limits. I think Hollister Community Center will play a key role as it reopens with their new public computer lab adjacent to the ADRC of San Benito County, where we can put some great training programs in place. So poll result is up. Closing digital divide is no surprise of popping up the highest, but a number of things are in the 40% range. So we know there's a lot of work to be done in different areas here. I'm going to jump to the next one. We're almost out of time for the day, so I'm just going to go through these really quickly. Yes, Andy?
I just saw another hand up, but I'll just leave it to you to get through the rest of the goals before we wrap up. Thanks.
Okay, so, and I'm going to encourage more than ever for people to put your ideas in the chat. That way they will get out there and you won't get caught off or miss them. Caregiving that works. This is just such a huge issue, especially as the population ages. How do we have the support that's needed to keep people in their home or even in institutions? Institutional care, it might not be everybody's priority, but it's certainly a critical piece of how we're structured. And if you have good care in institutions, it's a lot better experience than an institution with poor care. What do we do about that? A local plan, our local aspect that we have right now underway that works extremely well is health projects, centers, caregiver universities. These happen throughout our Tri-County area, and they're just what they sound like. It's a day-long or half-day-long workshop on how to become more skilled in care. Can't have enough of them. And I've never seen one where the surveys don't show very positive feedback on what happened, and always a great turnout, and just anecdotal anecdotal feedback is always positive too. So it's just one example of what we're doing locally. But always, what other goals are there out there? Who are the leaders that can move things forward? How do we have enough workers? That's a huge issue. I know Alicia and I have talked about that. Brenda and I have talked about it. And of course, John and Mitch and I have talked about it. How do we have enough caregivers in our community? I'll throw out one thing too. Why do we not have MSSP in San Benito County? Multi-Purpose Senior Service Program, which provides in-home support for individuals who are literally nursing home eligible. Why is it missing? It's a no-brainer in terms of saving money and saving personal quality of life.
Right.
So throw your ideas out there, questions. Jane has a great question. Cabrillo College still offering caregiving classes with a certificate? No, they aren't. That was a program that John and I helped get going, which was a series of caregiver training classes that were offered through Cabrillo Extension. And I think there were like, 6 or 8 classes. So those stopped. They were all, every time we did one, they were sold out. So they did pay for themselves. Why not? I think that's a question for Cabrillo College. And I think, who are the local leaders? I think we don't see in this discussion, and part of that is probably our outreach efforts. How do we get engaged with universities and colleges and even high schools around all of these issues? So because of time constraints, let's jump to goal 5, and people can ask questions or make comments. Affording aging. We have a great program with the volunteer center that just got started as a result of COVID, a response to COVID. And it seems like maybe this isn't about affordability, but it totally is. If people can't eat or can't get their food or medications or other critical things at their house, that it's much more difficult to effectively age. And I think one of the things that these goals show us is how much cross-pollination there is. We could put senior nutrition here as well, or almost any of our support programs. They could live in many places. But one thing I like to say is that if you look at the services in the community, we have the services, most of the services that people need, and most of them are extremely cost effective and personally effective in meeting the need. So we don't, in many cases, we don't need to reinvent the wheel. We just need to have adequate resources for the services that are out there. There should be no older adults who can't get food, not in this community, not in we're Salinas Valley, Pajaro Valley. We can't feed people. That's obscene. Housing people, everybody should have a house. Everybody should have adequate income security. How many, .com millionaires, multimillionaires are living in our houses here? Yet we don't have enough. Policies have to change around that.
Or not living
so
in
Bridget,
them. Or I just have to say, or not living in them and they sit empty. So that's another issue.
Yeah, absolutely. Yeah. So more questions are coming in. So we kind of raced through these last 2, and keep your comments coming. Sandy, I don't know how quickly you want to wrap up, if you want to run over a little bit. It's it's your call. I know lots of people have other meetings to get to.
Yeah, I want to be mindful of the time. We did start about 5 minutes late. So I'm, if folks want to stay on and ask a few more questions before we close, I'm all right with that, but we should at least announce the poll results, right? All right, everybody can see. Yeah.
And one last thing about this, there's part of the new budget has money to get more seniors connected with CalFresh, with food stamps, which is a great thing. But older adults, especially the poorest ones, have Social Security. So they have some income. It's inadequate, but they have some income. And the result of that is it pushes the amount of CalFresh that they qualify each month down to a really low amount. So you're trying to convince people that it's worth it for them to jump through hoops to get $28 in benefits a month. So, that's a problem and a challenge. Of course, the, $28 helps, but, how much time and effort do you want to put into that? There is a bill making its way through the state right now to provide a simple application process for older adults. So hopefully that could help us.
That's great. Ray, I saw your hand up, but it looks like it's down. Just want to, all right. So I don't want to leave us hanging here. I do want to, as we close, think about next steps and how we will build our own action plan at the local level.
Yeah, so that's the next step. So I suggested that we, that staff kind of compile the suggestions here, and then we have a discussion at the advisory council level about what to do next. But it's going to be critical that we engage partners beyond our normal network to move it forward. So how we do that, I think we have to rely on the advisory council members, the city council and county supervisors here, to make sure it's not just us talking to ourselves and, making grandiose speeches, but not having any action or meaning around those. So, that's kind of my thought about it. The other piece of it is, there's lots of resources out there for building it. I think evaluating our success is a key thing, that once we have the plan in place, we want to make sure that we're using tools to evaluate if we've made a difference. And, obviously staying connected is where it matters. And connectivity means not just, the 75 of us that met today. It means, the 20 people that everybody knows. And so the 1,500 people that we have direct contact with, and, the tens of thousands of people that our connectivity can lead access to, especially, I'm going to throw it on the electeds. You guys have the public forum. I think those of us providing service don't.
So that is absolutely critical. I'm excited to start looking at the list that's generated out of this meeting. I see that folks are, getting in touch with each other here through the chat. So I want to make sure that we on the council do everything we can to support those efforts. And so we'll be rolling up our sleeves and then reaching back out to folks. All right. I guess that means we're wrapped up, and I guess that means, as the chair, I will close the meeting. It was really great to be here with you all today. Thank you all for all of the work you do. Not everybody who is here was recognized, but I see you, and we know how much work you all do, and your dedication to making our community an inclusive place, a place where for all of us, right? And you work really hard and you with very little fanfare. So I want to give you a round of applause, everyone who's here, for all the work you do. And thank you, and look forward to working with you in the future.